All right, everybody, welcome to this fortnight's health presentation from the Care and Family Support Team. My name's Patrick. I'm the ACT Care and Family Support Coordinator. This week we're going to be talking about bladder and bowel care, which is arguably one of the most important secondary health concerns that you will encounter when you have a spinal cord injury. I'm sure most of us here can probably say that they've had a UTI at least once in their lives, probably much more. Joining us today, we have Edwina from Coloplast, who is going to go through and talk to us about proper bladder and bowel care and some of the products that are out there that can help us. So I'll pass things over to Edwina and she can take it from there. And I'll pop myself on mute.
So hi everyone, my name's Edwina. I'm a clinical nurse consultant working with Coloplast. So I've been nursing for 24 years, which feels a lot longer than that, I can tell you. And I'm really passionate about trying to normalise conversations around bladder and bowel management because we all do it. So I'm really passionate about finding really good solutions for people and making life a lot easier for people. So I'll start with a little bit of a presentation. This is very interactive, so if you have a question, please ask. You can even chat in the, type in the chat box. I may not see it, but I'm sure Patrick will monitor it. Very happy also, not everyone is quite as comfortable as me about chatting about it, so you can always have a chat to me afterwards, contact me privately afterwards as well. And I do have my first face-to-face clinic coming to Canberra, which is a free clinic, which is on the Tuesday the 24th of May. So I'm going to touch a little bit on continence care today. Obviously, legal disclaimer, the following materials are presented for general information purposes only. They don't ever constitute proper medical advice and don't constitute for a consultation with a trained professional. So agenda today, as I said, we're going to be really related. We're going to do on how it works. We're going to talk about what a neurogenic bladder is, so what happens when you have a spinal cord injury. Some of the red flags to look out for, so some things that we may be able to recognise that there may be something going on. We're going to also touch about refresher on bowel function, talk about neurogenic bowel, touch a little bit on Peristeen, which is a TIE system or a transanal irrigation system, and then where to get help and questions and answers. So we all know the impacts of bladder and bowel dysfunction, okay? Physiological infections, we end up with pressure sores, sitting in wet pads, wet pants. That can actually turn into surgical considerations. Psychologically, distressed, embarrassed, we don't like to talk about it. It does feel like a bit of a loss of control. As a result, often socially, what happens is we withdraw from everyday activities, lose our confidence of going out, avoid going out, and it actually puts a really big strain on our personal relationships. People don't ask for help, and they can be really distressing and isolating. However, there are so many treatment and management solutions available out there. We just need to talk about it. So, basics. You know how the urinary system works, so I'll just do a little basic touch. Your kidneys, obviously, that's what filters the liquid waste. Travels down your ureters, it's stored. Urine is then formed and stored in your bladder. It's held there by some little sphincters, some little muscles that basically hold the urine in there. And then, obviously, at the time, what happens is the sphincters relax, or we use a catheter or whatever we do. The urethra opens and empties the urine out of the body. So, normal bladder. Okay. Empties 4 to 8 times a day. Okay, every 3 to 4 hours. Can hold 400 to 600 mils of urine. However, often what happens is when your bladder gets to about 200 to 300 mils, you get a bit of a sensation that, there might be a little bit of stuff in there and you may need to start thinking about finding a toilet. Sometimes it wakes you up at night, especially as we get a little bit older, and it will often tell you when it's full, but it gives you plenty of time to find a toilet. So what is a neurogenic bladder? A neurogenic bladder means that basically that normal process where the bladder fills and empties actually doesn't work properly. So what happens, either the bladder fills without emptying or it actually empties unexpectedly. So generally, the type of neurological damage, it depends on what, the effect it's going to have on our bladder. So this is where we're looking at people with spinal cord injury, multiple sclerosis, spina bifida, and so forth that end up with a neurogenic bladder. So basically what happens, those nerve signals get interrupted. So bladder and bowel resides in the sacral area, okay, so right down the bottom of the spinal cord. And messages then, when the bladder or bowel gets full, messages go up the spinal cord to the brain registers it, sends a message back to say, yep, empty your bladder, do this, do that, whatever. What happens is when you have a neurological injury is those messages don't clearly get through. So what happens is you end up usually with one of two things, either incontinence, which basically means you can't store, so you can't hold, and urinary retention, which means you actually can't go. So there's really just you can't hold or you can't go. Sometimes, depending on your injury, you can have a little bit of a mix of the two, just depending. So as I said, can't hold, can't go. They're pretty much your two problems. So what happens when you have a spinal cord injury? So you end up with different types of bladders is what we end up with. So looking at the middle of your back, you've got a T12, which is kind of the midpoint of your back. Now, when you have an injury above this level, what happens is what they call a reflex bladder. So what happens is you actually can't store urine, so they don't hold urine in there. So when you've got a higher injury, what happens often you get quite a lot of leakage in between, and you often end up with some kinds of medications to actually stop you from leaking all the time. When you have a lower injury, so T12 and below, you actually can't go. So these guys generally end up with having to use a catheter or some kind of drainage device because the bladder just won't go by itself. Simple as I could get it. So pathway to suitable treatment. So we need to identify a problem. Okay, don't suffer in silence if you have any of the symptoms, which I'll discuss shortly. Diagnose the problem. So go see your GP or your specialist and have a chat about your symptoms. Work out a treatment plan. So whether it's sending off a urine specimen to make sure you don't have a UTI, doing some urodynamics, which is basically a measurement of all the pressures in the bladder to see how all, your sphincter and all your muscles and stuff are working as well. And then looking at treatment options, whether it's medications, absorbent products, catheters, etc. So varies with each person. Some little red flags. Leaking or coughing when leaking urine when coughing or sneezing. I can tell you I've had 2 children, and this is definitely something I have. Leaking urine on the way to the toilet, so you don't have enough time to actually get to the toilet before going. Passing urine more frequently, more than 8 times a day. Having to rush, shouldn't have to rush to the toilet. Getting up twice or more during the night. Feeling like the bladder's actually not empty, so you've got a bit of a heaviness feeling in your stomach, in your abdomen. Wetting the bed when asleep. Weak or really slow start to your urine flow. Straining to empty the bladder, so that's using your abdominal pressure to try and push the urine out of your bladder. Frequent urine infections. Okay, urine infections I'll touch a little bit later. They are not normal. We want to try and avoid them as much as we can. And feeling pain while passing urine. Okay, should never have pain. These all say maybe we need to look at what's going on. So loads of management solutions that people do for urinary retention. So I'm talking about people now a lot of the time that can't go. Okay, so this is the lower injury category that actually can't go. So we've got indwelling catheters and intermittent catheters. So these are different types of catheters. You've got your non-invasive stuff, which is your reflex voiding, which is basically using positioning to empty your bladder. And then you've got the invasive side where you've got a Mitrofanoff, which I'll touch on shortly, and a suprapubic catheter, which I'll touch on shortly as well. So these 2 options actually require surgery. So Mitrofanoff, you don't need to look too much at this, but basically what it is they make use the appendix, basically, and they make a little tract that you can actually empty your bladder. So you use an intermittent catheter, and what happens is they make a little channel that comes out your belly button, and what you do is every couple of hours you pop a catheter in, empty your bladder, pull the catheter out, throw the catheter in the bin, and you do that every couple of hours. So you're basically just emptying. It's almost like you'd be doing it normally, but the urethra is kind of coming out your belly button. So this is one option. This is really common in children who struggle to often get down to be able to empty their bladder appropriately between their legs. So this is a really good option for that. You've got an indwelling in your suprapubic. So your indwelling obviously comes out from between your legs, so through your urethra, and you've got a catheter that goes in. They're changed, every 4 weeks, depending, and then they set to empty your bladder. Suprapubic catheter is a medical procedure, so it's an operation, and they make an incision in your tummy, and they pop a catheter in that gets changed about every 4 weeks, depending, and it drains your urine into either a bag or a toilet. So these ones, the suprapubic catheter stays in pretty much all the time, and so does the indwelling. So intermittent catheter. So basically, this is probably the biggest area I focus in. The intermittent catheter is where you're basically popping a catheter in, which on a tube, drain urine out of the bladder, remove the catheter, and throw the catheter in the bin. Okay, so you've got nothing left in the body. And they talk about this being gold standard. So that basically means around the world, it's really the most recommended form of bladder management, long-term bladder management for neurogenic bladders. However, as I'll go into later, not one solution is ever going to suit everybody. So what suits one person is not ever going to suit another person. So it's a matter of finding that. So I'll touch a little bit on intermittent catheters and the benefits. So basically you have unbroken sleep. So often what happens is you can empty your bladder effectively, that you don't have to get up in the middle of the night to empty your bladder. A little bit more independent at doing it, increased self-confidence, less episodes of urinary incontinence because you're emptying and managing your bladder a little bit better. Normal sex life, so there's actually nothing left, so no tubes or anything to get in the way. And less chance of UTIs, febrile episodes, stones, and issues with renal failure. So there's so many studies on this, but I think you would all be asleep if I started talking about them. So I always get people to have a bit of a look at this toilet and think, where would you put stuff? So if you had to go in here and do a catheter, which is a relatively clean procedure, where would you put stuff? So there's kind of no bench. It doesn't look particularly hygienic. So I always think to people using different type of products depending on what they're doing or where their situation is a really good option. So having more than one option is always really important. Okay, and I'll touch a little bit on some stuff a little bit later. The other thing I'm going to talk about is basically why you would have a catheter that's nice and slippery, ready to go. So the fancy term is hydrophilic, but basically it's a ready to go catheter. Okay, so you don't have to add lubricant to it. You pretty much open the packet and it's ready to go. Decreases UTIs, decreases urethral damage. So by that they mean if you're using a normal catheter, and I might have to turn the camera off shortly so you can actually see my camera. But basically when you do a catheter, let's say you're doing one where you put the lubricant on and you pop the catheter in, all of the lubricant is staying on the outside of the body. So when you're withdrawing the catheter, that's when a lot of the irritation and damage is done. So withdrawing that catheter is where we like to have something that's hydrophilic coated. Compact catheters, so catheters are a little bit easier to manage when we go out, improve quality of life, and it's a person's right to have a high standard of health. I think a lot of you, if you're on the NDIS, will probably agree one of the best things to come in was the NDIS in regards to allowing people a lot more choice on dictate on how they live their life. So UTIs, oh my gosh, I hate UTIs. Research shows that UTIs is one of people's biggest concerns. Okay, it's actually a daily concern. So 41% of people actually worry about this every single day. So this is a huge concern for people. Users on average have 2.7 per year, and the concern actually stays pretty high no matter how many years you're actually doing your intermittent catheters. So 49% when you're less than 1 year of injury, and then that moves to 42% and then 40% 5 years plus. So you can see that this is still ongoing, a really big concern for people. I think you've all probably had a UTI and knows how debilitating they can be and how much they actually put you out. So some other little things I'll talk about when inserting a catheter. So watching for things like strictures, which is basically scar tissue. You need to relax when you're popping one in, be in a comfortable position, look at the correct technique, and if having trouble passing, seek medical advice. Okay, pain is not normal. Can be made a little bit worse by tension and anxiety. Ensure adequate lubrication. So even if someone doesn't have feeling, you need to still use lubrication. In men, ensure the correct position of the urethra, which I'll go to shortly. And then I'm going to touch on it. So UTIs, as I said, main complication in people with intermittent catheters. You would all have different symptoms: fever, pain, burning, cloudy urine, feeling unwell, fatigue, blood in your urine, confusion. Generally, these days, they only treat symptomatic UTIs. So that's UTIs where you actually have symptoms. Some people actually end up with no symptoms and they generally don't treat those. How to reduce your risk: maintaining good fluid intake, 1.5 to 2 litres a day. Obviously, if you've got problems with heart failure, we don't want you to drink this much fluid. Really hard to build into your day. What I find with people is I encourage them to work it into their day. So I find I was getting to the end of the day and I was, I have had nothing to drink. Oh, no wonder I feel really dry and I actually haven't done a wee. So that's not great when I'm sitting here all day promoting good bladder health for people. So what I find now is I've just built it into a routine. So when I wake up, I have a glass of water. When I have my morning coffee, I have a glass of water. When I have my morning tea, I have a glass of water. So I've just built it all through the day so that then I get to the end of the day and go, actually, I've had heaps of fluid intake, which is really good, and I know it's good for my bladder. Regime, as I said, keeping bladder volumes to 400 ml, so we don't want them to get too big. If your bladder gets too big, what happens is sometimes the urine can kind of go backwards and it pushes up into your kidneys and causes kidney damage. Good hygiene, okay, good hand washing and genital washing, good technique, and as I said, using those lovely slippery catheters. So what I'm going to do is I'm actually just going to take this one off and stop sharing. And I'm going to show my screen for a little bit. So can you all see me now?
Yes.
Beautiful. So I'm just going to chat really briefly with technique, both male and female. So this is Roger. Okay. Roger's my friend here that's going to help us talk about intermittent catheters and all the different types. So there's loads of different catheters. There's more catheters on the market than you can poke a stick out. What it comes down to is finding one that works for you, okay? Finding one that's good for you and one that works with your lifestyle. Something straight like this, okay, pretty standard catheter, okay, pretty easy. Little sticky dot, so you can actually stick it on the wall. So this is great. Remember thinking back to that grotty looking toilet that we actually don't need to hold, okay? So we can actually stick it onto the wall and then you've got your catheter, okay? So what some people find with this one is we're obviously washing and you're using a neutral wipe. If you're at home, you can just use a lovely warm washer. But basically what you need to do is wipe the bacteria from the end of your penis before doing your catheter, okay? So bacteria is great on your skin and it's really normal, but we don't want that pushed up into our bladder, okay? So obviously cleaning around the tip of the penis. If you're circumcised, you just need to pull the foreskin back and give it a little bit of a clean, okay? So what we do is we do penis up to start, okay? Pop your catheter in. Now, we don't want to touch anything with it. We want to go straight in, okay? So we do this, okay, we need to chuck it out and get a new one. I know that's really hard because they're a bit expensive, but if we touch it, we actually don't want to contaminate it, okay? So what you do is you pop it in the bin. So penis up to start, okay? Now, once you get to about here, This is where your sphincter and your prostate sit, okay? That lovely thing that gets bigger as we get older. Okay, so your sphincter and your prostate sit here. So once you get to about here, you get a bit of resistance. Okay, this is where you get your resistance just before the bladder, because that's what keeps the urine in there. Okay, so there's a couple of things you can do. One, drop your penis down. Okay, and that can just give you a little bit of a better angle to be able to squeeze through. The other thing you can actually do is have a cough. So when you have a bit of a cough, what happens is you temporarily open that sphincter up to allow the catheter to pass through. So if you're kind of getting to here and you're struggling a bit, have a bit of a cough. Just undo my prostate. There we go. Okay. And you can pop that one through. Okay. So then that goes through. Okay. So what we do is we wait for it to empty. Okay. Wait till it stops draining. Before we remove it, I get people to have another little cough, because what that does, it compresses the bladder and pushes the last little bit of urine out, and then slowly withdrawing it. Okay. If you get to here and it starts draining again, just stop, let it drain completely, and then very slowly withdrawing it. Okay. We chuck this in the bin. We don't promote reuse anymore. I think technology's come a long way. I know some people still do it, and it is sometimes our only option, especially when financial. We start to think about financial things, because catheters are expensive. But we try and really promote really single use, because it really decreases your risk of UTIs, which we don't want to end up with. So there's hundreds of different options. It's a matter of finding one that suits you. So another little one we've got is attached to a bag. Okay, so this is great if you go into a toilet and you don't want to touch anything, you don't want to transfer, you don't want to sit on anything, or I don't know about you, we went to Queensland last year and had to stop because I've got an 8-year-old. We had to stop on the way, and we stopped at a pit toilet. Holy moly. If you've ever been into a pit toilet, I don't know whether I'd be wanting to do a catheter in one of those. So something like this is a really good option, because you can actually catheterize. A lot of people catheterize in the car. Not that any of us are doing a huge amount of international travel, but a lot of guys I know who are quads will transferring into a toilet in the bathroom in a plane is really hard. So they pull a blanket over their head, you use something like this, and they can actually catheterize on the plane. So this one basically unwinds and pulls out, and then there's your catheter ready to go. Okay, so this is pre-lubricated, which means it's lovely and slippery, ready to go. Okay, so obviously you wouldn't touch it and then do a catheter, but we pop our catheter in. Okay, so penis up to start, then penis down, let it drain. Okay, and then when you're finished, same again. And what you can actually do is you can push it back in, twist it, and then all of the urine stays in there. Okay, so that's a really good option, especially if you're traveling. And this one here, you just rip off, tip it into the toilet. If you want to, you can actually tip it on your lemon tree, because lemon trees absolutely love the ammonia in urine. Whenever my nephews come over, I say, go and wee on the tree, because it's really good for it, and it's much cheaper than buying nitrite stuff at Bunnings. So it's good for your tree. So that's our gentleman. Looking at ladies, okay? You're not going to be able to see this. I'll try my best, but you just can't see it through a camera particularly well. But finding the right spot is definitely the biggest challenge we have as females, okay? It's really hard. It's probably a little bit of a design fault. However, finding the right spot's really important. So generally, you've got your entrance to the vagina. Just above that is where your urethra sits, okay? So we've got little things like little mirrors to help you find. Oh, I think I've lost my mirror. I'll have to find where I put it. We've got little mirrors that I can give you to strap on your legs so you can actually see what you're doing, because that's going to be half your battle. So hundreds of different options to choose from again. Okay. So we've got something like this one. A female catheter is a little bit shorter, because the female urethra is only 4 centimeters, whereas the male urethra is 90. Okay, big difference. Got your little sticky dot there you can stick onto the wall. Okay. Open your catheter.
When I was in the hospital, they were trying me with intermittent catheterizing, and when it'd go into the vagina, they'd get me to just leave the catheter there and get a new one.
Yep. Sometimes they do that. Yeah, absolutely. Yep. Sometimes they find that good because it can be really hard to find the right spot. So that's probably the hardest thing for us ladies, is finding the right spot. So what we do is, okay, obviously cleaning. I actually say the vagina is incredibly smart because it's self-cleaning, okay? It sorts itself out. But the bacteria that it has in there, we don't want pushed up into your bladder, okay, because you'll end up with a urine infection. So exactly as you do with a gentleman. So wiping around, okay, and obviously front to back. You've got your catheter, okay. This one, again, is a nice little slippery one ready to go, okay. And you're obviously popping straight in. If you hit the side here or go into the vagina, as you said, you need to throw it out and get a fresh one, okay. It's not worth a UTI, okay. So popping the catheter in, exactly the same again. You're draining the bladder. Have a bit of a cough before you remove it, because that pushes the last little bit of urine out. And then withdrawing, pop it in the bin, and you're done. So we have some other little options for ladies. So we have one that looks like a lippy. So I have a lot of teenage girls that love this. And when they go out, they'll take a couple of these, a little packet of wipes and a little hand sanitizer, and they can actually fit it into a clutch, okay? Because we don't want to take massive big bags, you know, when we're young. So having a smaller bag is really convenient. So this one basically opens, you hold it like a wine glass. It's flat at the bottom. I think everyone knows how to hold a wine glass. Okay, it goes flat, bit of a wiggle, and that's your catheter, okay? So the idea is this is really discreet and nice and private for people. So you're not going in with a big siren above your head saying, hey, look at what I've got. The idea is if your, child spills your handbag all over the floor, and this pops out, people are going to have no idea what it is. People aren't going to go, oh, that's a catheter. Okay, so the idea is it's really discreet. Okay, so they're a really good option. We've also got the same option for females with a bag. Okay, which saves transferring sometimes over onto a toilet. Okay, so exactly the same option. There's this one and a twist, and there's your catheter ready to go. Okay, so it's a matter of finding the right product for people. Okay, so what you might use at home might be different to what you use at work, which might be different to what you use, when you're traveling. So the idea is it's finding the right combination of stuff to actually suit your lifestyle. So do any of you find, since being on the NDIS, does it make all of this stuff a little bit more accessible? Or not notice much of a difference? Yep. Perfect.
Well, I'm not covered by the NDIS, so I have to be a bit more careful about the economics.
Yeah. I actually wish for the day that they actually change that 65 cutoff, because I think they really need to look at that. There's a big petition going around that I've signed, I think, a couple of times, because I think, how is it kind of fair that you're 64 and you have an accident and you get this amount of cover, but when you're 65 plus. However, there is a little bit of a change coming to My Aged Care, which is coming in July. So my understanding is, I don't know a huge amount about it, but my understanding is it's a lot more of a generous package for people. So I think they've actually listened, and they've actually realised that there's this huge number of people in the market that actually need much better access to stuff. So apparently in July that's coming. So that'll be really exciting, because it'll open your options up. I really hope it does. So, because as I said, everyone deserves a right to, the same access of medical treatment.
Edwina, can you hear me?
Yes.
It's Richard England.
Hello, Richard.
I'm with RSL Life Care for a number of years.
Yep.
And when I was making up my plan with them, I actually insisted that they cover the cost of my catheters, gloves, wipes, all that sort of stuff. So that is covered under my plan. I'm a level 4. I'm an incomplete quad. But you had to make sure right at the very start that that is included. And then every 3 months when the case manager comes round, I insist that that's still in there. The other thing that I'd just like to mention while I've got your attention is you mentioned surgery. I had a bladder augmentation, I can't pronounce it, a chlamystostomy or whatever it's called.
Yeah.
Because I found that I was leaking all the time, even though I was catheterizing 5 times a day. I'm an incomplete C5 to 7 quad since 2006. And I was going up to Professor Richard Millard in Prince of Wales to get Botox injections regularly. Their side effect was it took all the wrinkles out of the old fella, but it would only work for about a few weeks instead of 9 months. So I ended up having the chlamydostomy done in about 2011, I think.
And fantastic.
That has made a big difference, yes.
Good. Yep, good. Yeah, because I was going to say Botox is quite common in regards to helping that. But as I said, if it's only lasting a couple of weeks, then that's definitely not enough. I thought I'd quickly also just touch a little bit on condom solutions as well while we're chatting about it. So these have come a long way again. So I remember when I first started nursing 20-something years ago, they were horrendous looking things that came with 2 big sticky pieces, and you'd put one direction and one direction, and they never worked. So they've come a long way now. So basically now they come ready to go. Okay, take them out of the packet. Find where poor Roger's gone. Okay, basically it holds on the tip and you pull. Okay, and that pulls straight on. And then what that does is that completely seals. Okay, and then when someone wants to go to the toilet, you can connect it to a bag. But when you want to actually go to the toilet, you just disconnect the bag, and then connect it back up again. So these are a really good option, and these stay on for 24 hours. Obviously, if you're doing an intermittent catheter, you obviously can't get it through there. So it's not an option for those, but it's a good option for, some of the leaking that can happen. So then removing, you just roll off, chuck it in the bin. Okay. So I thought I'll quickly touch on that one as well while we're here. Any more questions about the bladder stuff before we get into the fun bowel stuff? Nope. Bowel is my absolutely favourite topic, believe it or not. I am so passionate about it because I can see the difference in so many of my patients that it makes having really good bowel management. So it really just changes people's lives. So we'll pop back on here again. Let's see if I can do it. How does that? All good?
Yes.
Beautiful. So we're going to touch a little bit on bowel care and then transanal irrigation.
Your digestive system consists of all the organs involved in breaking down the food you eat, absorbing nutrients and eliminating waste products. When you take a bite of food, your digestive system is activated automatically. In the stomach, the food is broken down into smaller pieces and digestive juices are added. The now liquid food is passed onto the small intestine, where the nutrients are absorbed and digested. In the large intestine, also called the colon, water and salts are absorbed, causing the waste products to become firmer and turn into stool.
Very graphic.
The stool is then pushed through the intestine towards the rectum by a series of muscle contractions known as peristalsis. You have 3 to 4 major peristaltic movements each day. The time it takes for food to pass through your digestive system is called the transit time. The average transit time for females is 2.4 days and 1.9 days for males. When stool fills your rectum, nerve endings register that your bowel wall becomes distended, and a signal is sent to your brain telling you that it's time to find a toilet. At the same time, your internal sphincter relaxes by reflex, and stool moves down towards the anus. When you are ready, you consciously allow the external sphincter to relax, and stool is expelled. In between going to the toilet, both the internal and the external anal sphincter are contracted to keep you continent.
So that holds everything in when we're not
Your
going.
digestive.
So, chatting about normal bowel versus neurogenic bowel. So what happens is, looking at this T12 level again, when you have an injury above, what happens is your inability to feel when the bowel's actually full, and you often have issues controlling the anal sphincter. So the anal sphincter is basically your bottom hole that holds everything in, okay? So when you have a higher injury, what happens is often people end up with a tighter sphincter or a sphincter that doesn't open and relax to let everything out. So your flaccid bowel is your T12 injury and below. And what happens is often the sphincter stays open, so the bottom stays open, and this often leads to accidental emptying. Okay, these guys have lots of problems, holding everything in. So, bowel dysfunction has a severe impact on quality of life. Okay, really significantly emotionally distressing for some people, which affects self-esteem, personal relationships, and social life. So having a little look at this research that they did, they actually found that bowel function was up there with sexual function and in regards to how it impacted people's lives. So bowel function is a humongous impact on people's lives. The biggest thing I actually took out of that research is many people with neurogenic bowel dysfunction spend a significant part of the day on bowel management. So up to 63% of people spend more than 1 hour each time trying to go to the toilet. So that's a humongous amount of time. Having 2 young children, I probably have 5 minutes. So I really, try and help people with this one. So the burden. So this research was done in 2017. So this is pre-COVID. 40% of people had an anxiety disorder who had severe bowel dysfunction. 36% missed a vacation. Obviously, with COVID, that would be 99.9% of us. 38% actually had depression within the last year, and 33% had their personal relationships harmed. So there's a huge impact that bowel dysfunction has on people's lives. So why bother changing? 47% of chronically constipated adults are actually not satisfied. So what the biggest thing I took out of here was 1 hour and 14 minutes was the average time spent by a spinal cord injured patient on bowel management per day when using bowel medication. So when I'm talking bowel medication, I'm talking, your Movicol, your oral medications, and your enemas alone. Okay, so this is your traditional bowel management. So I'm going to touch a little bit on Peristeen and what it is. So basically what Peristeen or transanal irrigation is you insert a catheter into the bottom, water is introduced into the rectum and colon, and then subsequently that water and everything in the descending colon is evacuated into the toilet. So you can see on this little picture here, obviously where the bottom is. When you do traditional bowel management, so when you're doing enemas and oral medications, you're pretty much just emptying that bottom bit, which is the rectum, and then that rectum goes a tiny little bit into the sigmoid colon. So that's about all you're emptying. When you're doing the Peristeen, you're emptying all the way up to your, what we call your splenic flexure, which is the top of your descending colon. So you can see the picture there with the water on the left. That's where it empties. So you're actually emptying a massive amount of stool. So really be clear out.
Interrupt. I actually do the digital rectal stimulation with a lubricated gloved finger.
Yep.
And I do that a couple of times a day, and it mainly just works once a day, but I find that effective because I have no notice that my bowel is full. I've got a little bit of feeling around the anus,
Yep.
Then I generally get a little bit hot or red in the face, that sort of thing. And I find that is a bit sort of messy. I was wondering, will you be touching on suppositories at all?
Absolutely. I can very happily chat about that kind of stuff. Yeah, absolutely. So how suppositories work is obviously they're introduced rectally. So these are, your Microlax, your Bisolax. And what they do is you squeeze the fluid in. Often, people then wait 20 to 30 minutes or hold it in as long as you can. So what they do is they set a chemical reaction off to kick off that peristaltic movement. So remember in that little video, there was that little snake movement, muscle contraction that pushes everything along in the bowel. So basically what happens is when you have a neurogenic bowel, you don't get that lovely smooth movement, okay? So you don't get that lovely peristaltic movement. So what you find is that enemas, what that does is it sets off a chemical reaction to stimulate that response. So what you'll find is it stimulates the body to kick off that peristaltic movement and push everything through to give you a better emptying. So that's how enemas and stuff work. Oral laxatives, there's so many different ones on the market. Things like your Movicol are called an osmotic. So basically what that does is drags water into the stool and makes the stool a little bit softer to pass. You've got all your stool softeners. So you've got your Coloplast and all of those that basically soften the stool, so make the stool not so hard to pass. And then you've got, other ones with Senna. So something with Senna in it, so Senacot, Coloxyl Senna, what that basically does is that Senna kicks off that peristaltic movement. So what it does is it stimulates the body to do that peristaltic movement to push everything through. So that's how they kind of work. So different combinations work for people. I always say to people, if traditional stuff is working, stick to it. If it's working for you, fantastic. When it starts to not work or not be effective, that's when you need to start looking at other options, whether it's looking at something like transanal irrigation, whether it's looking at introducing more enemas, whether it's looking at diet, whether it's, then looking at something like a stoma, so formation of a colostomy. So different things suit different people. Peristeen is not for everybody. Stomas are not for everybody. So not one solution is ever going to suit. So it's a matter of finding the best solution for you and to fit in with your lifestyle. So I know it's a bit of a confronting picture, that one, but I'm going to show you the difference between doing something like Peristeen and doing something like traditional bowel movement. So this is just a nice little quick video. And hopefully
Transanal irrigation, or TI, is a well-documented technique for emptying the bowels and is effective in preventing fecal incontinence and chronic constipation compared to conservative bowel management. The irrigation is performed by introducing water into the bowel via the rectum using a rectal catheter while sitting on the toilet. When the recommended amount of water is introduced into the bowel, water and stool are emptied into the toilet. If carried out every day or every other day, TI can allow the user to stay continent until the next irrigation. You will now see a demonstration of how transanal irrigation works. This is a scintigraphic picture of the colon before it has been emptied, where fecal matter can be seen in bright yellow. The image shows a large amount of fecal mass throughout the descending colon and rectum. Now look at the after irrigation picture. Here, fecal matter indicated by yellow is hardly visible anymore, showing how transanal irrigation has emptied the descending part of the colon and the rectum. After performing transanal irrigation, it takes, on average, 2 days for new feces to reach the rectum, allowing the patient to stay continent between irrigations. Peristeen Plus is a TI system that helps people manage fecal incontinence and/or constipation. A healthcare professional trained in the use of Peristeen Plus transanal irrigation needs to be consulted before the patient performs the irrigation procedure. It may take some time for the bowel to adjust to this treatment, but once it does, users can decide when and where to empty their bowel with Peristeen Plus. Peristeen Plus is a TI system that helps people manage fecal incontinence and/or constipation. It is easy to assemble and use. The easy-to-connect catheter provides a sound and feel indication when connected correctly, and it is designed to stay in place during irrigation thanks to the inflatable balloon. The catheter has a hydrophilic coating and is for single use only. Peristeen Plus grey tube connector is easy to connect to the water bag lid, and the tube with turquoise connector is easy to attach to the control unit. The control unit is easy to use. Symbols are intuitive, easy to remember, and to distinguish. The knob provides a good grip and is easy to turn. Peristeen Plus tubes and control unit must be replaced after maximum 90 uses. The water temperature indicator on the water bag makes it easy to know the proper water temperature range for the irrigation. After 15 usages, the water bag needs to be replaced. Screw top must be kept when replacing the water bag, as a new one is only provided with a full system. Peristeen Plus is portable, compact and lightweight for optimal mobility, allowing users to do the procedure at home or on the go, so they can feel more confident and in control of their bowel movements.
So, fascinating stuff. Now, I'm going to touch a little bit on here and we're going to talk a little bit about it. So you can ask any questions. So obviously I've got blue dye in my bag for the fact that you can actually see it. Normally, obviously, you wouldn't be putting blue dye in it or you would end up with blue bottom. So we wouldn't want that too much. So you've got 3 components. Got a catheter, okay? You've got a handset and you've got a water bag, okay? There's little straps if you want to attach it to your leg, okay? Because, you know, we don't have 15 hands to try and do this with. So first thing you do, okay, you've got little sticky dots if you want to stick it onto your toilet wall. But you've got your water bag, okay? You're not going to be able to see it here, but there's a little temperature dot which tells you that you've got the right water. So you want lovely warm water, okay? Too cold, you end up with really bad cramps that last 48 hours. Too warm, and you damage your natural lining of your bowel, okay? So that tells you the temperature that it's at the right one before you're ready to go. So connecting it up, okay, as I said in the video, you just twist, okay? I'm only going to briefly touch on this one, so you know how to put it together. You've got a blue and a grey end, okay? Grey goes to grey, blue goes to blue, okay? I do have one patient that can't see colours, so what I've done is I've labelled 1 and 2 on his, so he knows he can actually see black and white, so he actually labels it that way. So twist it on, exactly the same again. You twist it on. So first thing we want to do is we want to lubricate that catheter, because even if we don't have feeling, we want to actually lubricate that catheter, okay? Because it's got to go in the bottom. So first thing we do on our little handset, okay, we flick over to water, okay, and I'll pump a couple of times. You'll see the water start to move through, okay. Water start to go through. Yep, it's on the right way. Good. Beautiful. Okay. We get our water in. A bit hard to show on a camera. After 20 seconds, this is actually activating that coating, and that's actually ready to go. Okay, so you don't need to add any further lubricant. That's actually ready to go. So holding our little finger grip. So this is lovely and slippery now. And this is where we pop it in our bottom. I'm just going to show you the balloon so you can actually see what it looks like. So as I squeeze here, you'll see there's a little balloon that's there. That's basically what acts as your plug to hold your catheter in. Okay. It's a very, very soft balloon. Okay. It's almost a bit like when you'd have an indwelling catheter. It's a really, really soft balloon. Okay. So it's designed to hug the bowel wall. Okay. So just deflate that. Otherwise, it's not going to go in. Okay, so inserting nice and gently into the bottom. Okay, please don't shove it in. We don't shove anything anywhere near our bottom. Looking at perforation risk is one of the biggest questions I get asked. I'm a bit of a numbers person. I love statistics. So looking at statistics-wise, you get a colonoscopy, your risk of perforation is 1 in 1,000. Your risk of perforation with Peristeen is 2 in a million. So the idea is, the reason we keep it so low is that we do lots of screening and make sure it's the right treatment for people. So as I said, it's not for everybody. And you actually do, we'd like people to see a healthcare professional before actually starting them on Peristeen. So once you've inserted into the bottom, you can inflate. And what you'll find is that catheter actually stays in by itself. Okay, so you've got your plug ready to go. And then we flick around to our water, and you'll see the water start to move in as we pump it. Okay, there's your water going in. Okay. Now, water does two things. Obviously, one, it washes all the stool out. So it obviously lubricates and washes the stool. But the other thing is that water stimulates peristalsis. So that fancy word I was talking about, that snake movement, it stimulates the body to kick that off. So the thing I like about Peristeen is that it, I just had it on the wrong setting. The thing I like about Peristeen is it uses water. So it's something that's easy to travel with, and it's something that's sustainable long term. Okay. So once we do we get our water in. Okay. Once we get our water in, we then go around to our balloon deflate. Balloon pops down. Catheter pops out. Okay. And that's when you sit on the toilet up to half an hour, because it can take up to half an hour for that muscle contraction to settle down. You disconnect. Okay, that gets thrown in the bin. You disconnect on the top here. Okay. This one goes to the straight one, which basically drains everything out. Okay, drain all the water out. And then that gets packed away till you're ready to use it again. So the idea is, when people start Peristeen, I like them to do it every day for the first 2 weeks. And what that does is, as well as establishing a bit of a routine and getting used to something, it gives you a really good clear out. Okay, so it gives people a really good clear out. Often after 2 weeks, because you're emptying such a large amount of stool out, people can go down to doing it every second day. Okay, so they do it one day and then they have a day off and then they do it the next day. Okay, so it makes it usually a lot quicker for people. So that's one of our options. And we've talked a little bit about enemas. Obviously, your stoma is another option as well, which some people have, and it can be a really good option if, something like Peristeen is not an option. Sometimes the stoma is actually what suits someone's lifestyle. So very much comes down to that. But basically, it's a surgical procedure, and they basically put the bottom on the outside of the body, what they call a stoma, and it has a bag that goes over the top of it. It almost works like you would a normal one if you've got a lower colostomy, so it's sitting in the colon, a bit like you do a poo now, empties once a day, change your bag, give it a wipe, pop a new bag on. So that's how they work. So I'll just finish the last little bit before all of you nod off, because it's just about that time, isn't it? I'll go to and then, okay, hopefully that one's worked. So basically, you've got your Peristeen system. We've also got anal plugs available, which I'll show you at the end as well, which are another little option for you. And then the support program. So when someone starts the Peristeen, basically they come with me. So I cover New South Wales ACT. We have nurses that cover all the way across Australia and New Zealand. So basically you get contact with one of us. We just make sure that it works for you. We get it individualized and we get it working for you. So that's probably the biggest difference, is that, we come as part of the cost of the product. Benefits: improve symptoms of bowel dysfunction, reducing the time spent on bowel management, improves independence. So people are often able to do it themselves. I often have children You can use it from about age 3. I often have children doing it themselves from about age 8 or 9. And we tend to start doing it over a couple of years where we get them to control the pump or do other bits and pieces. Increased quality of life, reduces the frequency of UTIs. The reason being is it gives a really good clear out, so you don't have that really full bowel. And often it will actually risk the hospitalisation progressing to an ostomy surgery. So this is the support program that I was talking about. I can tell you it's not 4 calls over 12 weeks. It is as many calls as people need. So some people I will almost not hear from for 3 months, and I finally get through to them at 3 months and they're perfectly fine, no issues. Some people I speak to every day, which I'm very happy to just give them that support to get it working for them. So absolutely can go both ways. So people can call me as well as I call them. So the anal plugs, which I'll go into at the end for you, and I'll show you how one of those works. In Australia, we have this awesome organisation called the Continence Foundation of Australia. It's a not-for-profit organisation. It's basically our peak body covering incontinence stuff. So there's loads of information, loads of resources, loads of access to, private nurses on there as well and private healthcare professionals. And it's got, as I said, a national incontinence helpline. The other one is we have face-to-face and virtual clinics. So as I said, I'm just about to start a clinic in Canberra, which I've been trying to do for quite a while. And that's starting up in May, which is really exciting. So I'll fly in for that one. But basically, I teach and train intermittent catheters and Peristeen, chat about products and sampling, talk about product recommendations, chat about health and lifestyle stuff, and I also do pre-planning and support for NDIS. So I can do your costings of your products that you're using, and then I use a lot of evidence-based practice. So one of the biggest things I found with the NDIS is they want evidence. So I use a lot of evidence-based practice. So you can't argue with evidence. So often, it's good for trying to get stuff through the NDIS. The other thing is I did a series of podcasts. These may well put you to sleep, but it's probably everything we've chatted about anyway. But a couple of podcasts with Skia on their fantastic podcast. Oh my gosh, they have the best podcast. So fascinating to listen to. Actually, the latest episode is my favourite. But I did episode 3 and 4 on bladder and bowel, and basically have a chat about all those kinds of things. So that's if you want to do that. And that's it. Has anyone got any questions? Oh, I was going to show you the good old anal plugs. Lucky you. So this is a little anal plug. Okay. These are a really handy little device. So if you've got something really important, if you've got a wedding or if you've got something where you can't risk having a bowel accident, they're not going to hold in a whole stool, but they will hold in a little bit of leakage. So basically, like a tampon for your bottom. Okay. All right. Really soft little material, so it doesn't get, you won't get a pressure sore from it, from sitting on it. Lubricant on the bottom, and you basically pop it into your bottom. So what happens is when it comes into contact with water, the stuff you get excited about, this is my favorite product. I think it's all the spina bifida kids that I have that don't want to go swimming or can't go swimming because they might have a little bit of leakage. So they all put one of these in and they can actually get back in the pool again, which is really nice. So what that does is that pops open like that. Okay. That sits inside the bottom and it holds any leakage in. Okay. You can pass wind through it, but it will hold in that leakage. So often what this means for a lot of people is they can get out of pads and they can actually just have one of these instead, which is always nice. And then to remove, you just pull. You can see it squishes up. Wrap it in a bit of toilet paper and pop it in the bin. And that's it for me. Has anyone got any questions? You probably all.
Can you talk a bit about suppositories, please, Edwina?
Sure, absolutely. So in regards to giving them, in regards to how they work, in regards to different types?
Yeah, well, basically, as I said, I do a digital stimulation 2 or 3 times a day. which can be rather messy because you've still got your finger in there as the stool starts to come out. So it's not all the way around from arsehole to breakfast time, really. So would you sort of recommend, say, changing or trying a suppository?
Yeah, look, and absolutely worth.
How do they work? Do they work straight away or after half?
So they generally take about 20 minutes to work.
Right.
So what you can do is, I often say to people, lie on your side, on your left side in bed, because then if you think about where the bowel goes up and across and up here, okay? So if you're lying on your left side, okay, when you give the suppository, it's the most effective because it's going with gravity, so it's going down. So I say to people, lie on your left side in bed, pop a little bit of lubricant on the suppository, pop the suppository in your bottom. So depending what it is, if it's a microlax or something in a hard container, you squeeze the fluid that's in there. Some of the other ones, it's a bit of trial and error to see what works, is you can get ones that are dissolvable. So you just pop them in your bottom, little glycerol suppositories, pop them in your bottom and they dissolve. And what that does is it stimulates that peristaltic movement to bring everything out. So what you could do is try getting up, if you do your bowel care in the morning, popping a suppository in. You hold it in as long as you can. Obviously, if you've got no feeling, you'd want to probably be doing it over the toilet. However, a lot of the time, lying in the bed, giving it about 20 minutes or as long as you can, and then sitting over the toilet, and you'll find it probably happens a lot quicker. So you should get everything out a lot faster. So it comes down to trying different things. A microlax is probably a great way to start. Or they have little glycerol suppositories that you can get as well. So,
do you need a prescription for those?
No, they're all purchased over the counter.
Okay, thank you.
Yeah.
You can buy them,
and just buy some lubricant as well. Sorry, Eugene.
You can buy them at Coles and Woolworths, much cheaper than the chemist.
Really? I didn't know you could get them at Coles and Woolworths. That's fantastic.
Now, can you use them every day?
Yes, you can.
Get used to it or anything like that?
Yeah, look, this is where it gets a bit hard. So over time, your bowel gets a bit used to them. So you sometimes have to use more to get the same result. So it's a bit like something like Senna. So Senna, which stimulates that peristaltic movement, over time, Senna will cause a bit of a lazy bowel. So having Senna long-term is not a great idea, but short-term is okay. So what you'll find is always try traditional bowel management stuff first. So if you find suppositories and suppositories work great, when they start to not be effective, that's when to look at other things. So it's sounding like what you're doing at the moment, Richard's not particularly effective. So introducing a suppository may actually speed up that process for you.
Oh, well, it's effective. It's just that it's a bit messy, that's all.
Yeah, and it's a bit time consuming. So, yeah.
Now, I take Normacol in the evening there. What does that do?
So Normacol softens it.
Yeah.
So it softens the bowel. So softens the motion.
So does Movicol as well.
It does the same thing. Yeah, they're the same kind of acting thing. Yeah. Okay. It comes down to personal preference. So what works for one, it's not going to work for another.
Edwina, we just had a question in the chat.
Oh, sorry, I didn't see the chat.
Just were the pre-catheter wipes just baby wipes or special kind of
baby
antibacterial?
Wipes are fine. I don't like people using anything bacterial or anything that's irritating anywhere near, especially their private parts of the vagina or the tip of the penis, because what it can do, it irritates that natural mucosal lining. So I always say to people, a neutral wipe, a baby wipe, and if you're home, you can actually just use a warm washer. So the little ones I had was just our little skin cleanser wipes. So very happy to send you some out to try if you want to. They're actually quite a good size to have in your handbag too. They're not, some of the baby ones you get are really, really big. But as I said, if you're at home, just a warm washer because you just need to wipe that natural bacteria away. Please don't use an alcohol wipe. I have people that sometimes use that. I just find it's really delicate tissue. I mean, if you think about the inside of your urethra is a little bit like the inside of your lip, okay? It's the same kind of feel. So if you imagine if you're putting alcohol here, it's going to irritate that, okay? So nice and gentle. Thanks, Sally. Any other questions? As I said, any questions, very happy for you to pick up the phone and give me a call, ask anything. As I said, I do have my clinic starting, and my services are free. So I'm paid for, I paid a salary by Coloplast. So I'm still a registered nurse. However, I don't actually charge. So it's really nice, especially for those that maybe aren't on the NDIS and don't have that money in their budget. It's a really nice option as well. Save the money for something else.
Excellent. All right. Thank you, Edwina. The one thing that I was just going to mention as well, the products, some of the products that Edwina has shown today, I have plenty of those here at the peer support office. If anyone is interested in getting hands-on up close with them to have a bit of a better look, I've got plenty of demo products here to show. But aside from that, I'd just like to thank Edwina for the wonderful presentation today. And yes, if there are any questions that come up later on, feel free to send either myself or Edwina a message, or send me a message and I'll pass it on to Edwina. But aside from that, thank you, everyone.